It's 10:30 a.m. here in South Korea. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Son Young-le, spokesman for the Ministry of Health and Welfare, is now taking to the podium to brief us on the latest situation in Korea. Let's take a listen to what he has to say.
First of all, we will begin the briefing with the explanation by Mr. Son Young-le. Let us now begin our regular briefing for November 11th, Wednesday. As of today midnight, we have 113 new local infections, and among them we had 81 in the metropolitan area and 32 in the non-metropolitan area. And we have seen 4 days of the on-day cases in triple digits, and we also had 2 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. We are currently conducting our intensified quarantine for the vulnerable facilities, including nursing homes and long-term care centers, and including these facilities as well as mental hospitals. We are carrying out our extensive massive testing. In the metropolitan area, we have conducted and we have finished the testings for 160,000 people, and also in the non-metropolitan region, we will be continuing the testings for other regions as well until the 20th, and we will also conduct these testings for about 260,000 people. And as for the metropolitan area, which completed its testings every 2 weeks, we will be carrying out regular massive testings for the users and the managers who are working at these vulnerable facilities. And at the non-metropolitan region, we will also conduct these tests regularly and every 4 weeks. And together with this, we will also carry out intensified quarantine measures for these hospitals, and for the next 2 weeks we will be carrying out we have been carrying out the detailed quarantine measures and inspections, and we are currently analyzing these analysis right now. And in order to prevent the COVID-19 for the 2 months starting from November, we will be intensifying our quarantine and monitoring the quarantine situations for the daycare centers for the kids. And also we will look into the situations of quarantine compliance, but also other safety-related issues, including lunch as well as fire drills as well. And as for the quarantine measures for the places that where the foreigners reside in, we will also look into these areas going forward. And the Justice Department has also conducted massive testings for about 117 locations, and we have seen that there were 110 places that did not have full compliance to the quarantine measures. And as for these facilities, people did not have mandatory the self-quarantine measures as well, and also we will be conducting these intensified quarantine measures and monitoring together with the jurisdiction departments as well. And going forward, we will also brief you on the standard of the international conference during the COVID-19 era. And due to the COVID-19 pandemic, we have seen restrictions in the travel of globally, and also this has put an impact on the international hosting of international conferences. And considering this, during the pandemic season, we will also be having a separate standard to meet and to design for the law and the legislation that oversees the international conferences. And for this, we will also amend the related legislations, and starting from the month of April, starting from this year and until June next year, we will also carry out these amendments for international conferences that also have over 50 international attendees and that are carried over 2 days will be also acknowledged as international conferences. And as for these international conferences, we will make sure that there is a responsible employee who is responsible for quarantine measures, and also we will also conduct a regular monitoring and inspection for the compliance as well. And the government is also exerting its full efforts to supply the domestic R&D departments for the therapeutics and vaccine for COVID-19. And in order to provide support, we will also, and currently we have set up a pan-government support center to provide continued support. And this also gives in-depth consultations as well. And we have carried out so far 16 rounds of consultations to about 6 companies here in Korea, and we have given and we have received about 243 requirements from requests from the companies, and we have also swiftly responded to this. And we will together have today we will also have another round of these consultations, and we will going forward also carry out in-depth and also swift response measures for the private companies who are researching. And we will also intensify our supply for the clinical testings. And as for the 8th clinical trials that we have been carried out here in Korea, we have been giving them more allowances and more support financially, and this has been increased to about 35 billion Korean won. And we will also increase the targets of these financial subsidies, and we will also have an open call for such research and clinical testings. So we ask for your support going forward. And with the revamp of our social distancing measures, we have also an update on our social welfare facilities. And we have been adjusting the level of social distancing to level 1 starting October. And also this has been, under this we have been resuming the operations of about 100,000 facilities of the social welfare facilities nationwide. And we will also revise the guidelines that are supervising these vulnerable and social welfare services. And before we go to level 3, we will resume the operations of social welfare facilities to ensure these care services are provided to those who are in need. And also we will make sure, even when they are closed due to the social distancing measures, we will make sure that the support for the vulnerable class will be provided. And there are some details. With level 1, we will also limit the floor area space to about 1 person for each 4 square meters. And at level 1.5, we will also have people to book the services online. And also with level 2 distancing, we will also limit the people to about 50 indoors, and we will also have restrictions on consuming food indoors. And also we will be under level 3, we will be limiting these areas as well. And starting from level 3, we will also put a halt to these facilities, and we will only provide services to the most vulnerable class. And as for the vulnerable class, we will make sure that we carry out these facilities so that we can provide necessary support. And we will also provide multifaceted efforts, including delivery of free lunches, to help them alleviate any pains and discomfort. And lately, we are seeing a continued upward trend of the COVID-19, and starting as of today, we have seen that on a daily basis, we have seen a 99.7 cases of on-day increase here in Korea, and with 67 cases in the metropolitan area. And about also 3 have been reported at non-metropolitan areas. And depending on the discrepancies in authorities of the local governments, Cheonan and Asan in Chungnam region, and Wonju in Gangwon-do province, and Suncheon City in Jeollanam-do province have elevated the level of social distancing to level 1.5. And currently we have 49 patients who are in critical conditions, and we have more than 100 hospital beds for the intensive care units available, meaning that we do not have a medical burden. However, when we have continued upward trend, and we will have much higher risk of a major outbreak here in Korea. If this upward trend continues for the time being, we will also have to mull over elevating our social distancing level and within 2 to 3 weeks. And it is very crucial once again to abide by your daily quarantine measures, including washing of your hands as well as wearing face masks. And also at level 1, with the revamp of our social distancing measures, we will also mandate all more facilities that will comply with the face mask wearing compliance. And also starting from 13th of November, we will also have penalties and fines for those who breach the compulsory mask wearing in the public. And this will also be aimed at the facilities owners as well as the users. And currently, we have 23 venues that are subject to this mandatory measures, and including them, we will also have public transit as well as indoor stadiums and call centers as well as religious facilities, and also gatherings of more than 500 people. We will have the mandating of the face mask wearing for these kinds of gatherings as well. And going forward, we will also notify you of the necessary changes, and also as for in order to prevent and prepare for a possible losing of these face masks, we will also distribute face masks at public venues so that you could utilize them as well. And before we have an effective vaccine developed for the COVID-19, face mask wearing is the most effective and most economic measure to prevent yourself from the virus. And to this end, we also continue to ask you to wear your masks. Thank you very much.
현장 질의 받은 후에 온라인 질의 받는 순서로 진행하겠습니다. 구체적인 통계입니다.
That was a government briefing you just heard there, updating us on the latest COVID-19 situation in South Korea, which confirmed 146 new cases as of Wednesday midnight, bringing the accumulated total to 27,799. There was unfortunately 2 additional deaths, bringing the death toll to 487 rather. That does it for our coverage of this morning's briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.